Welcome back, everyone, to another deep dive. Today, we are going to tackle a topic that I think is really important and affects so many people, and that is drug interactions.
Mm,
How different medications can actually kind of clash inside your body.
absolutely.
So you've shared some really great materials with me on this, and I
Yeah.
think our mission here is to kind of pull out those like essential nuggets of information,
Yeah.
the things you really need to know to stay safe and healthy without getting like totally overwhelmed by all the complicated medical stuff.
Right.
Because I think this is something that affects everyone,
Oh, for sure.
not just people who are, taking a ton of medications.
Hmm.
We've got some great notes that outline the key concepts of drug interactions.
Yeah.
Some of those terms you might have heard, like enzyme induction and inhibition.
Right.
We're going to break those down and make them really understandable. And we also have this audio discussion that kind of brings everything to life,
Yeah.
puts it into more of a real-world clinical perspective.
Right.
And they even have some of those handy mnemonics that can help us remember all these complicated drug names and interactions.
Yeah, those are really helpful.
Yeah, they are. So by combining both of these sources, we can really get a comprehensive but still like manageable and digestible understanding.
Absolutely.
So let's jump right in. So first, I think it's important to understand why this even matters, right?
Yeah.
Like, why should we care about drug interactions?
So these interactions can have a huge impact on our health. They can affect how well our medications work, right? They can cause unexpected side effects.
Right.
And in some cases, they can even lead to some pretty serious complications. So knowing about these interactions can help us stay safe. And it can also help us make sure we're getting the most out of our medications.
Yeah.
It's about optimizing our treatment and avoiding those unintended consequences.
Absolutely. It's about being an informed patient, an advocate for yourself. And I think a lot of times you hear about this and you're like, oh, yeah, that makes sense. But like, let's make it real. Let's talk about some specific examples
Okay.
that'll really highlight why this knowledge is so crucial.
Sure.
So to kind of lay the groundwork, let's talk about how our body processes medications in the first place.
Okay, so think of it like this.
Oh.
When we take a medication, it goes through a journey in our body.
Hmm.
And a big part of that journey happens in our liver.
Okay.
Our liver is kind of like the body's central processing plant for drugs, and it uses special proteins called enzymes to break them down. This process is called metabolism.
Okay.
And these enzymes really play a crucial role in determining how long a drug stays in our system, how it works, and what kind of effects it has.
So it's not just like you swallow a pill and it magically does its thing.
No, definitely not. It's a much more complex process.
Right.
So these liver enzymes, they don't all work the same way. They actually specialize in different types of reactions, and the audio discussion actually uses this really fun analogy to describe them.
I'm intrigued. Tell me more about this analogy.
Okay, so they call it a scary family or Hotel Transylvania to represent all the different liver enzymes. It's like each enzyme is a unique character with its own quirks and personality. And some of these characters are responsible for dealing with some really important drugs where an interaction could have serious consequences.
So it's not just like one big happy enzyme family doing all the work.
Not exactly. They are a diverse group with different strengths and roles.
Okay, so we have all these different enzymes doing their thing, but then what happens when we start adding more medications into the mix?
Right. That's where things get a little bit more complicated.
Right.
So imagine those enzymes as workers in a factory, right?
Right.
Each worker has their own task and station.
Uh-huh.
And when you introduce a new drug, it can either speed up the workers or it can slow them down. And this is where the terms enzyme induction and enzyme inhibition come in.
Got it. Let's break those down.
Sure.
Enzyme induction.
So an enzyme inducer, right, going back to our factory analogy, it's like a supervisor that comes in and tells everyone to work faster.
Okay.
And what this means is that the enzyme activity actually increases, so the drug is metabolized or broken down more quickly, which can lead to lower levels of the drug in the body.
Okay.
And that can make it less effective.
So basically it's like clearing the medication out of your system faster than it normally would.
Exactly.
Okay, so inducer speeds things up, leading to lower levels of the drug. Now, I'm guessing an inhibitor does the opposite.
You got it. An inhibitor is like someone who throws a wrench in the works, slowing down the workers, or even blocking some of them from doing their job.
Okay.
So this decreased enzyme activity means the drug is metabolized more slowly,
Okay.
and that can lead to higher levels of the drug in the body.
Okay.
And that can increase the risk of side effects or even toxicity.
So it's like the drug is kind of hanging out in your system longer than it should. And that can lead to problems. Okay, that's a really great way to think about it. So it's all about how one drug can influence how our body handles another drug. Now, remember the audio had some pretty catchy phrases, mnemonics, for remembering which drugs are inducers and which are inhibitors.
And mnemonics are such a great tool. I love them.
Me too. It's like a fun little mental shortcut.
Yeah.
So for enzyme inducers, I believe the phrase they used was busy street, CPAP GPS.
Yes, that's the one.
Busy street, CPAP GPS. Okay, let's break this down so we can lock this in.
Okay, so the P stands for barbiturates,
Okay.
specifically phenobarbital.
Okay.
The U stands for St. John's wort, which is a herbal supplement.
Okay.
The C stands for carbamazepine, which is an anticonvulsant.
Mm-hmm.
Then R is rifampicin, which is an antibiotic.
Mm.
The first A is for alcohol.
Okay.
But it's really important to remember this is talking about chronic alcohol use, like long-term heavy drinking.
Not just like, a glass of wine with dinner.
Exactly.
Okay, so chronic alcohol use. What else?
Okay, then we have P again, and this time it's for phenytoin, which is another anticonvulsant.
Okay.
G is for grizafulvin, which is an antifungal medication.
Hmm.
And then another P for phenobarbital again. And finally, S stands for sulfonylureas, which are used for diabetes.
Busy street. Not the most grammatically correct sentence, but definitely memorable.
Mhm.
What about the enzyme inhibitors? What mnemonic did they give us for that?
Okay, so for enzyme inhibitors, get ready for this, it's sickfaces.com.
Sickfaces.com. Okay, wow, that's a lot. Let's unpack this one.
Okay, so we're going to start with S for sodium valproate, which is used for seizures and bipolar disorder.
Okay.
I is for isoniazid, which is used to treat tuberculosis.
Mhm.
C is for cimetidine, which is used for heartburn and ulcers.
Great.
K is for ketoconazole, an antifungal medication.
Mhm.
F is for fluconazole, also an antifungal.
Okay.
And then we have A again for alcohol, but this time it refers to acute alcohol use, so like a one-time heavy drinking episode, which is actually the opposite of the chronic alcohol use we saw with inducers.
Interesting how that same substance can have opposite effects depending on how it's used.
Yeah.
It is. Okay, so acute alcohol, yes, keep going.
Okay, then we have C for chloramphenicol, an antibiotic.
Mm-hmm.
E is for erythromycin, also an antibiotic.
Mm-hmm.
S stands for sulfonamides, another group of antibiotics.
Okay.
Then we have another C for ciprofloxacin, an antibiotic again.
Okay.
O is for omeprazole, which is used for heartburn and GERD.
Okay.
And M stands for metronidazole, which is an antibiotic. And then there are three more that are kind of like the bonus round represented by the CO. And those are grapefruit juice, amiodarone, which is for heart rhythm problems, and quinidine, also for heart rhythm problems.
Sickfaces.com. I like that. Those exclamation points at the end.
I know.
Really emphasize that those last three are some pretty significant inhibitors.
I have to say, even though these mnemonics are kind of silly, they really do work.
I know, it's amazing how they stick in your head, right? They really do. But it's important to remember, even though they're helpful for remembering these drug names, it's also important to understand the underlying mechanism, whether a drug is speeding up or slowing down that enzyme activity.
Yes.
Because that helps us really grasp why the interaction is happening and what the potential effects might be.
Right.
Okay, so now that we've got those basics of enzyme induction and inhibition down, and we've got these handy little mnemonics to remember some of the key players, let's shift gears and talk about how this all plays out in real-world health situations.
Okay.
Like, how can this actually affect us when we're taking medications? And you mentioned we can go through it system by system.
Yes.
So maybe starting with antibiotics, because those are so commonly used.
Yes. Very common.
So I imagine there are a lot of potential interactions there
There are.
that we need to be aware of.
Absolutely, especially since they're prescribed so frequently, right?
Yeah.
So it's really important to understand how they interact with other medications. And a common one that people ask about is how do antibiotics interact with oral contraceptives, birth control pills?
Hmm.
And there's a lot of concern that antibiotics can make the birth control less effective.
Yeah, you hear that a lot.
Yeah.
And it's like one of those things that's kind of like passed down through word of mouth.
Right.
Like, oh, you're on antibiotics. Your birth control might not work.
Right.
But is that actually true?
So the idea is that antibiotics might lower the levels of the hormones in the birth control pill, but most of the studies that have been done haven't actually shown a significant decrease in those estrogen levels with most antibiotics.
Okay, so maybe not as big of a worry as we've been led to believe.
Right.
But you said most. So I'm guessing there's an exception to this rule.
There is, and it's an important one.
Okay.
And that is rifampin,
Okay.
which we just talked about.
C-trap GPS.
Yes. Rifampin is an enzyme inducer.
Got it.
So it can definitely lower the levels of oral contraceptives, making them less effective.
Hmm.
So if someone is taking rifampin, it's really important to use an additional form of contraception
Okay.
to prevent pregnancy.
So that is a key point to remember. Okay, so maybe most antibiotics are okay with oral contraceptives, but rifampin is like the big exception.
Right.
So watch out for that one.
Yes.
Now, what about interactions between different antibiotics themselves?
Okay, so there are definitely some interactions between antibiotics and also between antibiotics and other types of medications that people might be taking. So for example, let's talk about ampicillin,
Okay.
which is a type of penicillin antibiotic, and how it interacts with allopurinol, which is a medication used for gout.
Okay.
So taking those together can actually increase the risk of minor allergic reactions to ampicillin.
Oh.
And while other penicillin haven't been linked to this in the same way, it's still something to be aware of, and generally it's recommended to avoid ampicillin in patients with gout who are taking allopurinol.
Okay, so that's one to keep in mind. What about antibiotics and, let's say, medications for high blood pressure?
Okay, so another example is the interaction between ampicillin and beta blockers,
Okay.
like atenolol, which are commonly used for high blood pressure.
Mm.
So if someone's taking ampicillin for a prolonged period, it can actually lower the levels of the beta blocker in the blood, making it less effective at controlling the blood pressure.
Okay, so it can actually interfere with the effectiveness of the blood pressure medication.
Right.
Now, are there any instances where taking an antibiotic, or specifically ampicillin in this case, with a beta blocker, would actually be more dangerous, like in the case of an allergic reaction?
Yeah, actually, that's a really good point. So in patients who are taking beta blockers, if they were to have an allergic reaction to penicillin or any other drugs, that reaction might be more severe.
Oh, wow.
Because the beta blocker might interfere with some of the body's normal responses to an allergic reaction.
I see.
So using penicillin cautiously in these individuals is definitely advised.
So it's not just about the medication itself, but also how it might change the body's response to an allergic reaction.
Exactly.
That's really interesting.
So it's about thinking about the whole picture, not just individual drug effects. Now, another thing to keep in mind is that combining different types of antibiotics can sometimes be a problem.
Oh, okay.
Like, for example, if you take a bacteriostatic antibiotic, which is like tetracycline, which works by preventing the bacteria from growing,
Okay.
and you combine it with a bactericidal antibiotic, which is like penicillin or cephalosporins, which actually kill the bacteria, sometimes that combination can actually reduce the effectiveness of the penicillin or cephalosporin.
Oh, interesting. How does that work?
So the penicillin and cephalosporins, they work best against actively growing bacteria.
Okay.
And if the tetracycline has slowed down that bacteria's growth, it can actually make the penicillin or cephalosporin less effective at killing it.
So it's like you're hindering the action of one antibiotic by using the other.
Yeah, it's kind of like they're working at cross purposes.
Interesting. Okay, so that's another one to keep in mind.
Yeah.
Now, speaking of tetracycline, that seems to have a few other interactions we should talk about.
It does. So tetracycline, the way our body absorbs it, can actually be significantly reduced if it's taken with certain things like antacids, dairy products, or supplements that contain certain minerals like calcium, iron, or aluminum.
Okay.
And what happens is that these substances, they can actually bind to the tetracycline in the gut, and it forms these compounds that our body can't absorb very well.
So it's like it's kind of getting stuck in your digestive system.
Exactly. It's not getting into the bloodstream where it needs to be.
Yeah.
And while doxycycline, which is a type of tetracycline, is the least affected by this, generally it's best to avoid taking any tetracyclines with these kinds of products.
So it really matters not just what medication you're taking, but also what else you're consuming around that same time.
Absolutely. It's all about timing and what's in your stomach at that moment.
Okay, so food and supplements can definitely play a role. What about tetracycline? And let's say something like insulin, which is so crucial for people with diabetes.
Okay, so taking tetracycline, specifically doxycycline or oxytetracycline, along with insulin has actually been shown to sometimes enhance the effect of insulin.
Okay.
So what that means is it can actually lower blood sugar levels more than expected.
Okay.
So if someone with diabetes needs to take a tetracycline antibiotic, they might need to either choose a different antibiotic or adjust their insulin dose and monitor their blood sugar more closely.
So that's one where close monitoring is really key.
Yeah, and sometimes choosing an alternative antibiotic is the best approach, especially for someone with type 1 diabetes whose insulin regimen is really tightly managed.
Right. You can't really just tell someone with type 1 diabetes to adjust their insulin
Right.
without, very careful medical guidance.
Exactly.
What about sticking with doxycycline? What about doxycycline and methotrexate, which we know is used for some inflammatory conditions, but also at higher doses for suppressing the immune system?
Right. So this is a pretty significant interaction, and it's particularly important for patients who are taking those high doses of methotrexate, like for cancer,
Okay.
because combining it with doxycycline can really increase the levels of methotrexate in the body, which can then lead to methotrexate toxicity.
Okay, and that's obviously a serious concern.
Absolutely.
So in those situations, generally it's best to choose a different antibiotic.
Right.
Okay, so high-dose methotrexate, doxycycline combo to avoid.
Yes.
Okay. Let's move on to another commonly prescribed antibiotic, metronidazole. I feel like this one has some pretty well-known interactions.
It does. So metronidazole has a really important interaction with ethanol, which is just the alcohol found in alcoholic beverages. And combining those can lead to this really unpleasant reaction called the disulfiram-like reaction.
Okay.
And it causes symptoms like really bad nausea, vomiting, flushing, headache, and it can just be really, really unpleasant. So this combination is absolutely avoided.
I think that's one that a lot of people are aware of.
Yeah.
You often hear about that one.
That, you can't mix alcohol and certain antibiotics.
Right.
So that's good to know. What else should we know about metronidazole?
So another important one is that metronidazole can also interact with lithium, which is a medication used to treat bipolar disorder.
Okay.
And what happens is metronidazole can actually interfere with how the kidneys clear lithium from the bottle.
Okay.
So it can actually lead to increased levels of lithium in the blood,
Right.
and that can lead to lithium toxicity.
Okay.
And lithium toxicity can cause all kinds of problems like confusion, problems with coordination or ataxia, and even kidney damage. So this combination is another one that we really try to avoid
Okay.
if possible.
So it's got a couple of pretty big avoid interactions.
Yeah.
Got it.
Okay.
Now let's talk about another class of antibiotics, macrolides.
Okay.
So this includes drugs like erythromycin, clarithromycin, and azithromycin, as well as the antifungal medications, ketoconazole and fluconazole. I remember these being mentioned as enzyme inhibitors. You are absolutely right.
Okay.
So macrolides and azole antifungals are inhibitors, and they primarily affect these enzymes called CYP3A4 and CYP1A2.
And remind me, what are those enzymes all about?
Yeah, so these are like, if we think about our liver factory again, these are like key workers in that factory that process a lot of different medications.
Okay.
So when these inhibitors come along, they slow down these workers, and that means that other drugs that are broken down by the same enzymes can build up in the body.
Okay.
And that's where we start to see those interactions.
So knock-on effect
Yes.
on lots of other medications that you might be taking.
Right.
Okay, so let's talk about some of those, maybe starting with sedatives like benzodiazepines.
Okay, so benzodiazepines, if someone is taking a macrolide or an azole antifungal, that can actually slow down the breakdown of the benzodiazepine.
Okay.
So that means they have higher levels in their system, and that can lead to increased sedation, maybe some confusion, and even some changes in behavior. So in those cases, you might need to lower the dose of the benzodiazepine or avoid using them together altogether
Okay.
to prevent those side effects.
That seems like that could be particularly risky for older adults
Absolutely, yeah.
who are already more sensitive to the effects of sedatives.
Right.
Okay. What about other medications used for things like anxiety or depression?
So buspirone, which is commonly used for anxiety, can also have its metabolism slowed down by those macrolides and azole antifungals, and that can lead to an increased effect of buspirone.
Okay.
So again, avoiding that combination is often the best approach.
So these enzyme inhibitors are kind of like amplifying the effects of other medications in some cases.
Yes, exactly.
Okay.
They're increasing the exposure.
Okay. What about medications for the heart, like calcium channel blockers?
Okay, so this is another really important one to be aware of. Combining macrolides or azole antifungals with those calcium channel blockers like diltiazem, verapamil, or amlodipine, or even with carbamazepine, which can also affect the heart. That can actually slow down the breakdown of those drugs, leading to higher levels in the blood.
Right.
And that can cause the blood pressure to drop really low, which can sometimes require hospitalization, so this combination is generally avoided.
Wow.
Yeah, that's one to be really careful about.
Okay, so that's pretty serious potential consequence there.
Mm-hmm.
What about other heart-related medications that interact with these enzyme inhibitors?
Okay, so cisapride, which is a medication that's sometimes used for certain gastrointestinal issues, can also have its metabolism slowed down by those macrolides and azole antifungals.
Okay.
And that can increase the risk of some really serious and potentially life-threatening heart rhythm problems. So that combination is a definite no-go.
Okay.
Definitely one to avoid. And then similarly, cyclosporine, which is used to prevent organ rejection after a transplant, should generally be avoided with macrolides and azoles because it can lead to very high levels of cyclosporine, which can be toxic.
It seems like avoiding these combinations is a common theme here with these enzyme inhibitors. Are there any other really notable interactions we should be aware of?
There are a few more. So Pemazide, which is an antipsychotic medication, can also have its concentration increased by those macrolides and azoles, and that can prolong the QT interval, which you see on an EKG, which can increase the risk of some really dangerous heart rhythm abnormalities. So that combination is also one we avoid. And even prednisone, which is a corticosteroid, can have its effects amplified by these inhibitors. So there's an increased risk of Cushing's syndrome.
Okay.
So close monitoring is really important in those cases, and if possible, shortening the duration of that antibiotic treatment might be considered.
It's quite a complex web of interactions.
It is. It's a lot to keep track of.
It is. Now, we've talked a lot about those macrolides and azoles as inhibitors, but what about a specific macrolide, let's say erythromycin?
Okay.
Are there any kind of specific interactions with other drugs that we should know about?
So erythromycin, one that we want to be aware of, is the interaction with theophylline, which is a medication used to treat asthma.
Okay.
And erythromycin can slow down the breakdown of theophylline, leading to toxic levels in the blood.
Okay.
And symptoms of theophylline toxicity can include things like headache, nausea, vomiting, confusion, even excessive thirst. And interestingly, theophylline can also reduce the levels of erythromycin.
Oh, interesting.
So it's kind of a two-way interaction.
They're both affecting each other.
Yeah,
That makes it even more tricky.
it does. And because of that two-way interaction and that risk of theophylline toxicity, avoiding
Sure.
that combination is generally recommended.
Okay. So it's not just that one drug affects the other. They can both kind of influence each other's levels, and that can be problematic. What about erythromycin or tetracycline and, let's say, digoxin, which is often used for heart failure?
Okay, so this is another interesting one. And this is one that only affects a small percentage of patients, but it's important to know about. So in about 10% of people, erythromycin or tetracycline, they can actually change the balance of bacteria in the gut.
Okay.
And that can affect how digoxin is metabolized.
Okay.
So it can actually lead to dangerously high levels of digoxin.
Hmm.
So patients who are taking these antibiotics at the same time as digoxin, they need to watch out for any signs of toxicity. Things like excessive salivation, visual disturbances, irregular heartbeats, and it's generally recommended to monitor their digoxin levels in these patients during that antibiotic therapy.
Okay. So it's not a universal interaction, but in that small percentage of people, it can be pretty significant.
Right.
Okay. Finally, with antibiotics, let's talk about their interaction with warfarin, which is a common blood thinner.
Okay, so a couple of classes of antibiotics, including cephalosporins, macrolides, and metronidazole, they can actually enhance the blood thinning effect of warfarin. And it's thought that maybe the antibiotics alter the bacteria in the gut, which then affects vitamin K production, which is important for blood clotting. And warfarin's action is actually related to vitamin K. So it's kind of like a chain reaction.
Yeah.
And some antibiotics might also have their own little bit of blood thinning effects.
Mm-hmm.
So those cephalosporins, macrolides, metronidazole, those have the strongest evidence for this interaction. And for patients who are taking warfarin and need to take one of these antibiotics, it's really important to monitor the INR.
Which is that measure of how well the blood is clotting.
Exactly.
Okay.
And while penicillin and clindamycin are often preferred for those patients on warfarin, they should still be used cautiously, and monitoring is still important.
So it's not necessarily about avoiding all antibiotics, but just being particularly careful
Yeah.
with certain classes. Okay,
Yeah.
That's a really comprehensive look at antibiotic interactions, which is so important because so many people take those.
Right. Very common.
Now let's move on to another group of medications that so many people take, and that is analgesics,
Okay.
pain relievers.
Yep.
So what are some key things to know about drug interactions with these?
So analgesics also have some pretty important interactions, and let's start with acetaminophen
Okay.
and how it interacts with alcohol. So we know that acetaminophen can be hard on the liver, especially at higher doses, and if someone is also drinking alcohol, it can further increase that risk of liver problems.
Okay.
So that's especially true if someone is fasting or taking those higher doses of acetaminophen, like more than 2 grams per day. So it's always a good idea to use the lowest effective dose of acetaminophen and to avoid excessive alcohol use.
So it's not just the amount of acetaminophen you take, but also those lifestyle factors like alcohol.
Exactly. It all plays together.
Okay. What about acetaminophen and warfarin, that blood thinner we talked about?
So the data on this one is a little bit mixed. But there is some evidence to suggest that there's an increased risk of bleeding when acetaminophen is taken at higher doses, again, more than 2 grams per day, or for a prolonged period, more than a week, in patients who are also on warfarin.
Mm.
So because of that potential risk, it's recommended to limit the dose and the duration of acetaminophen in those individuals, and also to closely monitor their INR levels.
Okay. So again, being cautious and monitoring
Right.
are really key here.
Mm-hmm.
Let's switch to aspirin, another very commonly used pain reliever.
Right.
What about some of its interactions?
Okay, so aspirin, it can interact with oral medications used to lower blood sugar, like the
Uh-huh.
sulfonylureas.
Okay.
And aspirin can actually increase the blood sugar lowering effect of those drugs,
Oh, wow.
which can lead to hypoglycemia or low blood sugar. So that combination is generally avoided.
So that's obviously a big concern for someone with diabetes.
Yes.
Okay. What about aspirin and other blood thinners, like warfarin?
So combining aspirin or other NSAIDs, which are the nonsteroidal anti-inflammatory drugs, with blood thinners like warfarin, that's significant.